Good afternoon. Thank you for the invitation. It's a great pleasure to hear the previous speakers. I'm very curious also of the ones that will be to follow. They contribute to my world a lot. The nonviolent communication is actually one of the most important elements for the family system that takes an effort to deal with behavioral addictions. I'm a therapist, a psychologist, and I deeply believe that whatever is happening with young people is an answer to the things that happen in their system. We, as therapists, we perceive symptoms visible in children and young people as symptoms of a disease that is in the family and not their quality. I am a supervisor in a prevention center that has a program for preventing addictions from advanced technologies. So we know that if there is a parent, one parent that comes to the office with a young person, then the chance of succeeding is higher. If there are two parents, then the chance of dealing with the consequences of overuse the advanced technologies doubles. If there are also siblings, then it's nearly 100% certainty that we're able to work out new ways of using screen devices and digital devices. So I'm very careful in thinking of children and young people as addicts. I think that these people have just strategies to deal with the reality that they live in. If we see their behavior as a strategy of coping, then we have other options of intervening. But also for them, if they hear they're addicted to a phone, to smartphone gaming, it's as if the family of that person delegated responsibility for the family system to the child. So the question is, who is the person? And then to what the family system where the child is, this child is invited, to what kind of communication the child is invited to, what kind of regulation the family system invites the child. I do believe, after seeing so many families, that the family system has power, has rules that young children, young people obey, and they need to look for ways to satisfy their needs. They want to have free will. They want to grow and develop, and the family system gives them power to satisfy all those needs. Today, I'm going to tell you about that. That's my topic of my interest. Can I have the next slide, please? I don't control the presentation here, but thank you for clicking the slides for me. I'm grateful to the whole technical team for support. So dysfunctional family system, when you think of it, is a system in which a structure, dynamics, and the relations lead to, firstly, stopping some natural health in adaptation ways for more tasks and more developments of children and other people in the family, but also there are new patterns of interactions that have negative impact. For instance, it can be physical and mental, emotional, physical area. What I see among very many patterns of interactions in families where children use too much technologies, the first one is that very rarely I work with deeply rooted patterns of using advanced technologies by a young person when other people in the family have healthy self-regulation ways. They use their free time in an adaptive way. And I think I haven't had this therapeutic situation. I've been working as a addiction therapist. I haven't seen a young person that is absolutely in opposition to the behavioral patterns of the family. So very often, it's the reverse. So new technologies become addictive quite often when the parents don't regulate their needs in a healthy way. They might be addicted to checking the mailbox or checking the news. So in the family, definitely there is a rule of using the screen devices. And there's a rule also that we regulate the mood, being alone and not using other members of the family presence. So I'm grateful to the previous speaker because she said that the other person is the source of our regulation. For children and for young people, it matters greatly because they don't have the self-regulation skills developed yet, just like people with mature nervous system. Particularly even more that if there's an unwritten rule in the family systems that we regulate emotions alone, then it turns out more and more that a simple way of self-regulation will be attractive. So a smartphone or a computer game may become this self-regulation tool, just as a virtual community can be. A family system has some rules that may not be conscious. In the therapeutic work, it's very beneficial to uncover them. So the rules invite the family members to behaviors that are risky and they're not beneficial for their development, but for the system from which they come from, the adults come from, these non-written rules are unfortunately beneficial. The system is more than a sum of components. So we can see often that children take some roles in dysfunctional families, for example, with alcohol addiction. We can see that the roles are harmful. For example, a role of family hero or a scapegoat in the family is harmful for the children. They cannot grow and develop in a way that uses their potential. And very often, they are often adults that struggle with DDA consequences. But then, if they take up this role, that protects the family system from falling apart because it enables an adult that is in a family with addiction to continue their own role. So this is a way of seeing inappropriate behaviors, the behavior that is harmful to a child. For example, the cycle of day and night that is switched, or lack of digital hygiene in the family system. This same behavior that is bad for the behavior, but from the perspective of the system is protective because it may turn out that a young person who does not spend time like that would have had more interest or more responsive parents. If they tried to gain that, they would be faced with lack of time and deficit of interest. Modern parents that I work with, just as Boston research shows, they have parental burnout. I don't want to use this notion to say that this is mostly responsible for parental competencies that are, I would say, decreasing in families, but it matters. The parents have so much theoretical knowledge. The reality that we live in is full of psychoeducation about it, but very often in the families, there's lack of practice. The competences of how it should be, how I would like it to be, what is needed. It's not rooted in my activities. They are not seen in the dysfunctional families. So there's a dissonance between what I know should happen in my family, would be good to my children, and what is a fact in my family is also a source of the parental burnout accumulation. It is related to isolation, feeling of failure, and we know from research that a parent that are strict but emotionally unavailable creates conditions that are favorable for the behavioral pathology and risky behavior. There's research from 2022 that shows that an increasing tendency for addiction in young people is due to the risky parental behavior, not enough emotional availability, inappropriate communication. In 2022, there was a research that showed that the patterns of using smartphones, it was done in Iran during pandemic, showed that people with less restrictive approach to technologies had more addictions and had more physical discomfort. Please remember that less restrictive approach to technologies in dysfunctional families, it means that the young people are responsible for the setting of the rules of digital hygiene and giving them competences. It seems to us often that our task is to set rules. Let me tell you my experience with digital hygiene. It showed me what worked, what did not work with children that had already consequences of excessive use of technology. So I made observation in parents that I invited to digital detox. It's a tool that we can use in very many ways, quite flexibly, but we know that wherever there are very negative consequences of using new technologies, such as anxiety disorders in children, and in those families, there were children who had such strong anxieties that they did not attend school, and at the same time they had features of unhealthy use of advanced technologies like oscillating around habit, but I'm really careful in using the addictions diagnosis in children and adolescents. So I invited six families to a digital detox in a protocol that assumed 6 weeks, and we get prepared to even start the detox. So it means that before we introduce a rule that we don't use new technologies at home, including we don't do it at home on Saturdays, we practice substitute behaviors. So if a family features that they would do board games, or they would go biking, or they prefer to play charades in the evenings, before we start the digital detox, we need to go practice those circumstances. We need to have good riding bikes for all the family members, game boards, and we need to check whether we enjoy the charades at all. Why does preparation matters? It's because that in case of children and young people, an effective intervention, effective tool that we're trying to implement is a tool that gives them a sense of efficiency and causality and empowers them. If we encourage children to change behavior, it's really important that this attempt is effective. It needs to be adapted to the capabilities of young people and taken care enough so that the young person is prepared to have this effort successfully. That's why we need to prepare as the whole family. Why is this causality, this feeling of being able to do things so important? Because before we're able to go to next attempt to change the so-called addictive behaviors, we need to prepare them. If the first attempt failed, children will be convinced that they are not able to do that, or the whole family failed, or we just kept it for 3 hours instead of 6. If they have the negative behavior, the conviction is that they are helpless against their own behaviors. I'm telling you about this in the context of dysfunctional families. Why? Because they were absolutely resistant to get prepared. Some families want to have a weekend detox. Some families are willing to prepare. But if at the level of the preparation there was resistance, then there was more indifference. Despite the consequences that their children were facing, they did not realize how important the preparation was. And the preparation was a prerequisite. It determined whether the detox will be successful or not. And afterwards, we checked whether we reduced the negative consequences of overusing of the technology. And we saw that the successful families were the ones where all the members took part in the digital detox. In all the families where single family members did not take part, where one child had the detox and the other did not, or one parent had a detox and the other parent went to bathroom, closed the door, and was shopping in Zalando, that it failed. And very quickly, there was a feeling that without the support of a family and of the whole system, very little may change. It's important because when we work with a system, we know that if a child comes alone to an office and they feel isolated in therapy and they're delegated to take responsibility for what is happening to them, the whole family just gives the problem to the family. They can change a little. So from the level of the office, the child will not change the system. But if parents come, and they are the ones who set the rules, they need to have insights of the rules to change them. Then, even the child is not needed in the office because we have parents then, and that introduces the change. So wherever the family was engaged and had a feeling that it is our task to change the way of functioning of our family, so that all members of the family feel invited to have a more healthy way of functioning, where not everyone felt responsible, it failed. Dysfunctional families in which I saw a great progress in therapy were the ones that had, all of them had a motivation to support well-being of this one person who had a problem. So in a family, a mutuality, the rule of mutuality, of equality and justice were important rules, but the mutuality was an important rule and everybody understood it. It enabled the whole family of better manage the reality of the change, which was the digital detox. So the reality is, if there's no cohesion in the family, it will not succeed. If the family is a system that is hermetic and resistant to change, it will not succeed.
Dysfunctional family and internet addiction research published in Current Psychology indicates that family dysfunction, such as poor communication and frequent conflict, is closely linked to the development of internet addiction. In adolescence, moreover, internet addiction may contribute to further deterioration of family relationships, creating a vicious circle of mutual influence between family problems and addictions. So this vicious sexual cycle is visible. It's evident. We can see this circular influence in the family, that new technologies are misused by all of the family members. That influences the family relationships, and the family relationships also influence the use of modern technologies. So we are used to looking at cause and effects and not a circular issue. So for us, everything is circular, and so we have cause and further effects, but it is also circular. So when we work with a family, with a child who's using new technologies wrongly, so we need to look for the place of change that's going to be most useful. So very often, dysfunctional families start with digital detox, switching the computer off, taking the screen away. And so when we have got the withdrawal systems, well, when we also have this level of stress in the child, we need to do it with the support of family doctor, of the child psychiatrist. And we have to remember that withdrawal syndrome is painful, so we need to limit that pain. So if we basically take the skin off the child, when this is the only way for the child to regulate themselves, we are going to face failure, and in my opinion this is non-ethical. So this is when we start from the wrong end, and the place of change, very often those families don't even look at that. And so if we want our child to change the way they use modern technologies, to use a different free time, we need to change our way of work, our communication, our way of building family rules, also our way to use modern technologies, and also our attitude towards the world of the children, and also understanding what important functions this new technology plays in the life of our child. So we are going to really give the right to use it that way. So I really want to emphasize the needs. I don't want to criticize the tools. We need to look what tools we have, and also we need to look at the needs and look at what we can do with the needs. So we can't really bring a child into the into therapy and believe that the child is going to just manage by themselves just with therapy. So when we look at addiction to new technologies, we can see that the relationship between parents and children is important. So we can see that regarding the influence of family, internet, gaming, and phone addiction in children and adolescents, there are many important studies from the recent years. So, for example, 2023 research noted that excessive parental control without simultaneous emotional support can paradoxically lead to the intensification of problems related to gaming and phone addiction. And also, 2022 studies show that family structure, including the quality of the relationship between parents and children, is a significant factor of developing internet and gaming addiction. So young people deprived of adequate autonomy often escape into the visual world to satisfy their needs related to freedom and independence. And when I speak with those young people, that even for those families where the parents are trying to introduce the internet hygiene, the internet is the only place where they can follow their hobbies, follow their curiosities. So devaluing the digital space is throwing the child out with the bathwater. So we need to be curious, and we need to look at analogical situations and also reality. How else can we satisfy this need outside of the digital world? For me, this is the sustainable development. This is when the child already has mastered the left hand, and we also exercise the right hand, that it is present as well. And really, young people like to use what they are good at. If we allow them to feel in the traditional analog world, then they will feel comfortable in it, and they will feel more comfortable, they will be more willing to use it as well. I know that my time is up, and on subsequent slides you will also find further research regarding the change in the brain when and what changes take place when a child is growing up in a dysfunctional family. So when you look at that research, you can see that just being in a dysfunctional family is an invitation to the digital world to self-regulate, to find relief as well. So whether we want it or not, it is the family who invites the young person into the digital world, and very often young people are forced to use it as well. So maybe you have got some questions. I'll be happy to answer them. So thank you very much for your presentation, and I would like to really thank Joanna and our technical team, because there were some technical issues along the way, but we are happy to have been able to listen to your presentation. Unfortunately, there's no time for questions. However, thank you so much for this, and thank you very much for your presentation and for connecting with us.